Hello, 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 hello. Welcome to my first live stream on YouTube. I don't think I've ever done many live stream on any other platforms, but this is the first time. This is the first for me here on YouTube. So why did we come on here today? I wanted to jump on here as the title suggests. That is a physician up in Dallas that had gotten his medical license suspended. I need to clarify this. His license is not revoked. There is a pending investigation to identify what truly went wrong and how did these patients in his care at the same surgery center that he worked ended up being harmed by this medication, bupivacaine. So anyway, backstory to this. And I got to see this, a colleague of mine sent this to me. And she was like, got to send this story about essentially this physician and moved straight out from the patient from Texas Medical was made public today. This physician, or he's a rookie. This was not like, we make mistakes. So he's a subject matter expert. I don't know when he entered, but I mean, if you've been a physician since what, probably been this longer, most been alive. So anyway, it was brought the attention is some activity at the facility work, surgery center up north in Richardson, led to a patient having, some type of event in the operating room. There was another report I read from a reporter that he failed to render CPR to a patient who eventually passed away, and because of the actions that he's being accused of, doing, one of his colleagues ended up taking one of the IV bags or IV fluids home and trying to rehydrate herself, and she ended up passing away. So anyway, so this is what's going on. This physician is currently subject to an ongoing criminal investigation relating to some serious cardiac complications. One patient's death connected to the respondent's presence. He's present at the Dallas County-wide surgery care North Dallas facility. And when you flip over, beginning May to September 2022, the respondent, meaning Dr. Ortiz, was seen in surveillance footage at the surgery care facility depositing single IV bags into the warmer in the hallway outside the operating room. I need to state this clearly. Putting IV fluids in a warmer in a hallway is common practice. We all do it. We all work in OR. Sometimes we don't use some IV bags and we just put them back. They go in a warmer because when you're in the operating room, it is cold. You cannot regulate your own temperature. We try to make sure we give you warm fluids. So this was not uncommon. However, when he deposited these IV fluids, this report continues in the warmer. Shortly thereafter, a patient will suffer a serious complication. So this was a recurring trend. Remember, we said May through September 2022. So anytime he would deposit something in the warmer, and maybe somebody went and got it for the next patient, a patient will suffer serious complication. So on June 21, 2022, a fellow physician, an anesthesiologist, took one tempered bag of IV fluid home with her. This is not something we do commonly, to rehydrate. When she got home, she inserted her IV into her vein and, started infusing this bag of fluids that she picked up from the hospital to rehydrate herself. And almost immediately had a serious cardiac event and died. Yes, this physician died while she was trying to rehydrate herself at home. The Dallas Medical Examiner autopsy report dated August 2022 concluded that her death was accidental bupivacaine toxicity. Bupivacaine is a local anesthetic. It is intended to be used at site. Let's say you're having surgery on your finger right here. The doctor will inject the local anesthetic, some lidocaine right here. If you had surgery somewhere on your body, the surgeon will inject local anesthetic right there to keep you from, having pain in that area. You know, these local anesthetics are not supposed to be flushed straight into your bloodstream. You know, whenever, let's say you having surgery on the leg, we, part of the anesthesia team, can do what we call a regional block, put a little anesthetic, around the nerve to stop the pain sensations from coming back up. If you are about to have a baby, this is for women, you can get an epidural. Some of the medications that go in the epidural are local anesthetics. If you, let's say you're having major orthopedic surgery, you're having, let's say, a knee replacement, you can get local anesthetic put in your intrathecal space. You get what we call a spinal, and that can stop any pain sensations from traveling from the knee to your brain so that you can perceive them. But never should we ever inject local anesthetics directly into the bloodstream. However, if you've ever had surgery and you've ever been put to sleep, right before you went to sleep, probably you felt like a little numbness coming on, a little metallic taste in your mouth, a little bit, ringing in your ears. You probably got a little bit of lidocaine. Lidocaine is another different local anesthetic. It's not as potent as bupivacaine. So during induction, when you're about to go to sleep, we use that to kind of like numb the pain. Some of the medication like propofol causes when it comes through your vein, it kind of burns. Essentially, this bupivacaine is never used in that setting. So this report states that bupivacaine caused that anesthesiologist death. So when they tested that bag, they went back and tested some more bags from the warmer and found that several bags were tampered with and they contained the bupivacaine and were not even labeled that they actually contained the bupivacaine. Because essentially, when you put medication in a bag, you're supposed to slap a label on it, say what's in it, what concentration, what else is mixed in there. Every time, no ifs or buts. But this does not happen. And of course, the tests were run on all the other remaining bags, because another healthy patient was in an OR and had a serious cardiac event during a routine surgery that ended up requiring, admission to an intensive care unit. Fortunately, that patient actually did okay. All right. On September 2nd, through social media posts and news outlets, the Texas Medical Board was actually, found out about, all these events that are going on at this surgery center, and that a fellow physician to this gentleman had passed away. And that's when they convened a meeting almost overnight and decided that they want to suspend this gentleman's license, this anesthesiologist's license, because they deem him it unsafe just for the sake of public safety. And the report goes on and stuff like that. But I wanted to take a minute and talk about local anesthetics and why some are toxic. Why some, like I say, lidocaine we can push through to a certain amount, and why this particular one was actually very, very toxic. I want you to keep a couple of things in mind. When we're talking about this local anesthetics, a lot of the studies that were done on a 70-kilo male. This patient that passed away was a female anesthesiologist. I doubt she weighed 70 kilos. So for 70 kilos is a lot of weight. And she was also a woman. So local anesthetics essentially fall into, this is just broad generalization, two broad categories, amides and esters. The granddaddy of ester, local anesthetic, is cocaine. Yes, I say that correct. Cocaine is a local anesthetic. It's actually used for dental procedures. Other anesthetics in that same class, procaine, tetracaine, benzocaine. If you've ever had it in spray, it's sometimes called a hurricane spray. That's benzocaine in that spray. The other class of local anesthetics I wanted to mention on here is the amides. And these are the bupivacaine, lidocaine, lidocaine, and bupivacaine. So for the rest of this video, I'm just going to focus on lidocaine and bupivacaine. Reason why I say lidocaine, it's one of the most common local anesthetics we use out there. And of course, bupivacaine is the drug that was implicated in this in this event that actually happened. So lidocaine. The way the local anesthetics work is when you give a local anesthetic, essentially they're just sodium channel blockers. But there is, and this is not the video to discuss, the pharmacodynamics or pharmacokinetics, like what the drug does or how the body, metabolizes the drug. But there's a couple of things I just want to, mention. How fast this drug will onset, like how fast it kicks in, how long it's going to stay around, and how potent these drugs are. So I just want to compare those two, the lidocaine and bupivacaine. There is something we call a pKa. Like I said, I don't want to discuss too much further into this, but essentially a pKa of this local anesthetic helps us know the onset of a drug. The closer that number to the pH of the blood, let's say, for example, the pH of the blood is supposed to be between 7.35 and 7.45. So we just roughly stay in the middle and say 7.4. The pKa of lidocaine is 7.9. The pKa of bupivacaine is 8.1. What that means is when I'm giving you this medication, either lidocaine or bupivacaine, let's call this bupivacaine and this lidocaine. If I give you lidocaine, its onset is going to be fast. It's going to kick in faster. Bupivacaine, on the other hand, is going to take just a little bit to kick in. It doesn't quickly kick in. Like its effects are not quickly felt. The second number I mentioned was the duration. How long does it last around? And we use a number called protein binding. We measure this by percentage. Lidocaine has a protein binding capacity of about 70%. Bupivacaine has a protein binding capacity of 95%. So once I give you this drug, for example, lidocaine, like I said, its protein binding is 70%, but that means that it's probably going to come off your body. It's going to be metabolized a little bit faster, broken down and kicked off the system a little bit faster. This drug that is bound at 95%, it's going to hang on for a while. It's going to hang in your body because, your proteins are pretty much circulating in your blood. Albumin is a protein. So, for example, lidocaine duration of action probably around 60 minutes. Bupivacaine is going to last between 120 to about 300 plus minutes in your body, depending on, if you have enough protein circulating. The third number I wanted to talk about was the lipid solubility, and this kind of offers an idea of how potent a local anesthetic is. The lipid solubility of lidocaine is only 366. The lipid solubility of bupivacaine is 3,420. Essentially what this means is this drug is so lipid soluble, like once it's put inside a lipid-rich environment, it is going to sink right in. It's going to mix in like really, really fast and sink right in. And it's going to hang on right there. So it only takes a small amount of this drug, a very tiny small amount, to give you the same effect like you will find with lidocaine. So imagine if you give somebody a full dose of, let's say, a whole bottle of bupivacaine. It's no wonder that, when she had this IV bag running wide open at home to rehydrate, she probably didn't even stand a chance. But like I said, this is an ongoing investigation. Look at the comment. We do not want to make any conclusions at this time. We don't know how those bags were tampered with. It is important that we have that clear. Okay, so absorption of local anesthetic. The route you give a local anesthetic determines how fast it's picked up. It is common knowledge, or it can be common sense to say that if I give something IV, chances are it's going to kick in a little bit faster versus if I give it underneath your skin. So if you give a local anesthetic IV, it's going to kick in really, really fast. If you give it down the trachea, the local anesthetic goes into the lungs. Boom, there is such a rich blood supply in your lungs that local anesthetic is going to be absorbed really, really fast. If you give it to in the caudal space, like if little babies, there is a space right here by the tailbone. You can just stick a needle right in and inject local anesthetic. That's going to get picked up like really, really fast. if you give it intrathecal, intercostal, around the rib cage and stuff like that, it's going to get picked up really, really fast. The slowest route you can give a local anesthetic is put it subcutaneous, right underneath your skin, because there is really not that much of a blood supply compared to, in your veins where blood is just moving around a lot. So that's like as far as absorption is concerned, the fact that she was injecting this directly into her vein, that's why it onset really, really fast. Remember, this is IV, fastest onset that there is. Another thing I wanted to talk about before I move on to, essentially what happened is the maximum safe dose you can give of, lidocaine or bupivacaine. Now we're talking about injection to a local site, listen to a muscle around somewhere a surgeon has finished cutting and sutured close. For lidocaine, on a 70-kilo male, it is safe to assume that you can give between 3 to 4 milligrams per kilogram, and the patient will be fine. Now remember, this is injection. We're not talking about straight into an IV. So let's say for lidocaine, I can safely give 300 milligrams, and the patient will be okay, injected into a site. For bupivacaine, on the other hand, it is 1.5 to 2.5 milligrams per kg. That means for a 70-kilo adult, I can give probably about 175 milligrams of this medication on a local spot, into a muscle somewhere, not into the bloodstream, into a muscle somewhere, and the patient will be fine. Because remember, the blood supply into the muscle is not the same as if in the blood vessels. And then, of course, the bupivacaine comes in different names. So you can have it named Marcaine. You can have it, Sensocaine, probably has epinephrine in it. And it comes in different concentrations. You can get it at 0.25%, meaning 2.5 milligrams. You can have it in, 0.5%, meaning 5 milligrams per ml. Or you can have it in, 0.75, meaning 7.5 milligrams per ml. And for this, effect to have happened so rapidly, it is possible that that bag that anesthesiologists used was tainted with possibly the highest concentration, the 0.75% bupivacaine. Now, this is what happens, if you take a local anesthetic and it goes into your bloodstream really, really fast. There is a phenomenon called LAST. I believe it stands for local anesthetic systemic toxicity. 3 things are going to be affected: your central nervous system, your cardiovascular system, and of course, you can also have nerve injury. You put too much local anesthetic and completely damage the nerve, it will no longer work. But we're not really concerned about that right now because this was going straight into the bloodstream. The nerve injury can potentially happen if I inject somewhere right here and there's a nerve in that spot where I'm injecting. And if I push too much local anesthetic right there, I could almost kill that nerve right there. But I want to focus on the first 2 that I mentioned, the central nervous system and the cardiovascular system. So what happens once that local anesthetic gets into the bloodstream? Well, first things first, if blood goes into your bloodstream, gets into your heart, it gets immediately pushed out to the rest of your body. When it gets to your brain, it's going to cross that membrane called the blood-brain barrier. Once it crosses that barrier, it immediately going to start depressing your central nervous system, meaning like you can go from being alert and talking and having this conversation to slowly maybe just going to sleep and stuff like that. If you ever gotten, surgery and you were going to sleep and maybe during induction, we gave you some lidocaine, like I was talking earlier, you probably started feeling like a little weird around your mouth, your tongue started feeling a little numb, had a little metallic taste and maybe ringing in your ears. That is that lidocaine that has reached all the way into your brain, and that's why you're feeling like that. But those, side effects that you're feeling are really temporary at that point. If too much local anesthetic ends up in your central nervous system, you can end up feeling restless. You might start feeling faint. You might have that ringing in your ear, a little visual disturbance, so you can't really see clearly. Your speech might start being slurred. You might have start twitching on your muscles, and full on central nervous system depression where you're completely discombobulated. You don't know what's going on. If it's a lot and there is too much that can become toxic, then you might end up with what we, seizures. Local anesthetic also have a side effect of being potent vasodilators. So like once it goes in the bloodstream, those blood vessels, they start dilating. What that does is your blood pressure drops. So you might end up with what we call hypertension. If there is enough local anesthetic in the system, it might even cause you to stop breathing. Now here's the key. Once the local anesthetic makes you to stop breathing, that means you have toxic amount of local anesthetic, bupivacaine, lidocaine, whatever it is, you end up with a condition called like you become hypoxic. Essentially, your body just lacks oxygen. And if your body lacks oxygen, let's say you're already hypertensive, that means your blood pressure is really low. That means there is not enough blood pressure to circulate into your tissues, picking up all those, metabolic wastes, taking them back up into your lungs and getting them wasted out. So you might end up starting to be acidotic, acidosis, it starts forming in your body. You might also become hypocapnic, meaning that the CO2 that is in your blood starts slowly climbing because you really have poor circulation. Here is what happens when all those three things, all happen at one time. When you're hypoxic, when you're acidotic, and you're hypocapnic. Essentially, the blood vessels in your brain say, hey, wait a minute, we need to supply more blood to the brain because this blood is, has, a low amount of oxygen in it. So we need to get more blood. So the blood vessels in your brain also dilate. Essentially, you increase the cerebral blood flow. What's going to happen? This blood that you're pushing into your brain already contains a toxic amount of local anesthetic. And what ends up happening is more local anesthetic is then pushed back up into the brain. So you almost hasten those central nervous system effects. The more local anesthetic goes into the brain, the more you have these effects of hypoxia, acidosis, the more local anesthetic is delivered again back into the brain. So those are some of the things that could happen. Now, if there is any, somebody was able to recognize that and intervene before it gets worse, yeah, you could probably be able to bring somebody back and, be able to save their life, put them in, 100% oxygen and maybe support their blood pressure, and perform some life-saving procedures. The second part is the cardiovascular effects of this local anesthetic. And this is a little bit more complicated for a simple YouTube video. So I'm not going to bore you with all the fancy, pathophysiology of what's happening. But essentially, like I mentioned earlier, local anesthetics, they block sodium channels, in the heart. The heart muscle has cells, called cardiomyocytes. Essentially, once you block these sodium channels, these sodium channels have to be properly functioning for these cardiomyocytes to be contracting, like right now, what's happening in your body, the right way in synchrony to push blood all around your body. If you have a toxic amount of a local anesthetic in your body, that conduction and that automatic rhythm, automaticity, where it's not told how to conduct, it's just contracting by itself, that gets dysregulated. And once you block these sodium channels, essentially, the heart, the electrical conduction that happens in the heart from, from the top right down, that also gets dysregulated. And if you were to look at an EKG, so let's say one of the things you want to recognize if this is happening, let's say in an operating room, is if you look at an EKG strip that's on a monitor where we have behind us, is you will see the patient start having long PR. You might even see a long QR, interval and stuff like that. The thing is, this physician, this anesthesiologist, she wasn't connected to the monitors when she was at home. She just thought she was, connecting a bag of fluids. So there is no way she would have recognized any of those changes ahead of time that, hey, something else is going on. You might end up with, dysrhythmias. Your heart, is supposed to conduct in a synchronized fashion. So if you have too much local anesthetic in your system, it might stop actually, being synchronous. You might end up in a heart block where the lower chambers are, contracting at a different rate versus the top chambers. And like I mentioned before, local anesthetics cause, hypertension. They vasodilate your blood vessels, so you end up with low blood pressure. Um, the funny thing about bupivacaine, though, unlike a bunch of all these other local anesthetics, is like when they get bound to the sodium channels that are in the cardiomyocyte, you know, when the heart is contracting during systole and when it's relaxing during diastole, most local anesthetics dissociate from the sodium channel. On the other hand, bupivacaine and the lidocaine, they don't dissociate. They sit there. So they create even more of a block. The heart is never allowed to truly relax. It's just laying there. So a combination of all these things, you might end up with what we call myocardial depression, where your heart just lacks enough enough calcium. I correct myself, corrected, to do its of contracting and pushing blood to the rest of the body. And if the heart gets into that standstill state, unfortunately, there is not going to be blood supply to the brain, and there's only one other imminent thing coming, and that's so like I said, this is an ongoing investigation. I have no idea how these facts became painted, so please making conclusions with this video. I'm just trying to share a message regarding local anesthetics and what could potentially happen if too much of a local anesthetic gets, in your body. Now, there is a special group of people, who can, with their condition, and if they get too much local anesthetic into their body, that condition can potentiate the toxicity caused by local anesthetic. For example, if someone is pregnant, if somebody has hypotassium, people with kidney failure sometimes tend to have hypotassium. If you're hypoxic, so you're lacking oxygen in your blood, if you're acidotic, like I was talking about, if these conditions are already existing in your body and then you get too much local anesthetic put through your IV, you could end up with a local anesthetic toxicity. So it is important for my clinician out there that, we're wary or we're just cognizant of, the time and the place to administer some local anesthetic, when to give lidocaine during induction or when not to give lidocaine during induction. So what can be done? In a control setting, meaning in the operating room and where we have monitors and we're able to see everything and we are aware of what just happened. Like, hey, I was giving this. I know it had a local anesthetic in it, but I think it's going too far. There are several things we can do. Number one, the best thing to do is prevent. Obviously, we do not take, this lightly. In the OR, everybody is communicating with one another, from the scrub nurse to the surgeon to the anesthesia professionals that are standing at the head of the bed. We know how much local anesthetic is about to be administered in the field, via through injection or maybe through like any pumps that are put in place just to prevent a patient from having pain afterwards. We all talk about it. We use those numbers I mentioned. What is the maximum safe dose that can be given? And we calculated them. We calculate those numbers based on a patient's weight. However, if all those things, fail, before I continue, another thing we can also do is whenever we're using local anesthetics is to always give a test dose. I'll give you an example. In labor, if a woman is about to get an epidural, before you put all the local anesthetics in there, you give a little test dose. You know, you aspirate. When you're doing a regional block, and before you inject all the local anesthetic around a nerve, you know, you might use a little saline through the catheter to visualize on your ultrasound, are you in the right spot? And then you aspirate to make sure you're not in a vessel, to make sure you're not going to inject the local anesthetic into a vessel. And once all those steps have been met, then you connect the syringe with the local anesthetic. Then you push the local anesthetic. Whenever you're doing a spinal intrathecal anesthetic, you always want to confirm that you have, CSF coming back out. And once you inject that, bupivacaine, you just want to make sure you're pulling back, that you're not in a blood vessel, because you do not want any amount of local anesthetic to enter the blood vessel, because the moment it does that, the heart is extremely efficient, especially in a healthy person. that local anesthetic, the next destination is straight into the brain. So what can be done? In a controlled environment, we can give what is called intralipids. Essentially, these are fat emulsions. We can give 20% intralipid at 1.5 ml per kg as a. Once that's done, that bolus might take what, 5 minutes. Then you can run those intralipid at 0.25 ml per kg for the next 10 minutes. Now, there is differences in literature out there on how much you can repeat, but I was taught that you can repeat this up to 3 times. Of course, consult your anesthesia book. If I'm wrong, please leave a comment below. I'm here to learn. I'm open to learning. However, coming back to this case in Dallas, of course, this anesthesiologist was not in a controlled setting. So there is no way she could have given herself intralipids and provide the sink that this bupivacaine needed. Remember, I talked about the lipid solubility being such a high number. When you give this intralipids, once you push them in the blood, the bupivacaine that is dissolved in the blood finds a new, more favorable sink to be dissolved in, which is the intralipid. Essentially, you're taking it away from the blood so that when the blood supply goes to the brain, this intralipid emulsion that is essentially, capturing the bupivacaine will not be crossing the blood-brain barrier back and forth. So essentially, it's almost like you're just sucking that, bupivacaine out of the blood and just letting it, be dissolved. And so these, anesthesiologists and for the other patient who might have, suffered a cardiac arrest because of a local anesthetic, toxic dose. Unfortunately, this was probably either not recognized or like the anesthesiologist, she was at home. There is no way she would have had access to, intralipids in her house. And it happened so fast that, even family probably wouldn't know exactly what to do. So, that is what I really wanted to do this video and just give an overview as far as what these local anesthetics do and, just kind of give heads up to other folks out there. So we don't know how these IV bags got contaminated or, how they ended up having this, bupivacaine in them. So essentially, this is an ongoing case. There is an investigation happening, and we just have to sit back and wait. And in fact, the Texas Medical Board acted so swiftly that this anesthesiologist, Dr. Ortiz, did not know that his license had been suspended until a reporter from a news station called him and said, "Hey, do you know your license has been suspended because of A, B, C, D?" And he's like, "What?" Yeah. So they, for the sake of public, safety, they thought that they want to suspend his license, stop him from practicing, anesthesia until such a time when they do, an investigation, determine how these, bags ended up in the area because we don't know how they ended up there. We don't know how the bupivacaine got in those bags, but they're going to do an investigation. Now, it is such an unfortunate story that ended up in, losing one of us, an anesthesia provider out there. And we're so short-staffed as far as anesthesia is concerned across the country that, when you read this, there is a family right now, without a loved one. And it's just a sad, sad story. The cautionary tale on this other end, though, is, folks, let's not be taking, stuff from hospitals home to administer ourselves. I really wish that this did not come to that. And in most cases, most IV bags that are, sealed and sterile, none of this would have ever happened. This is just a bad situation of either there was malicious intent, because I've never heard of this situation before. This is the first time. Either this was an intentional malicious intent or, accidental, but has happened multiple times. So I don't know how accidental that would have been. So anyway, like I said, this story is developing, and I don't want to stay here and just keep going on and on and on and on. I want to keep following this story. Please leave a comment below in this live stream. I'm going to save and keep it, on my page, so that we can maybe learn. I'm here to learn. Is there something that could have been done that could have prevented this? You know, um, moving forward, should all IV bags foods, should they remain, in maybe a locked environment where nobody's going to get to them and violate the integrity of that bag, add any additives to it. you know are we going to get to a point where I have to literally double check the IV fluid and before I administer them? Is that something we're going to end up doing? So we don't know. This is, like I said, this is a developing story. I will follow up and kind of read a little bit more to try to understand, how this could have happened. My heart goes out to the family, the lost loved ones, especially Dr. Casper. I'm pretty sure, this was one of those, you're living a good life and, doing what you love, but you never probably in a million years thought that, a simple bag of IV fluids, was tainted with bupivacaine, and that, literally just caused, demise. So my heart goes out to the family. And if you sat and watched this video to its entirety, give a like. Consider subscribing to the channel. I like to come on here maybe often in the future, talk anything healthcare, and maybe try to share some information from the anesthesia world. Thank you all so much for watching, and I'll catch you again next time.